Two, one. A very good afternoon and welcome to the session on abnormal uterine bleeding. We are glad to have Dr. Anshu Raina among us today to help us understand the topic. Abnormal uterine bleeding is bleeding from the uterus that is longer than usual that occurs on an irregular time. Bleeding may be heavier or lighter than usual that occur often as randomly. There can be different reasons for that. To help us understand better, the doctor will discuss this topic briefly and will take us through that in the session today. Doctor, you have the stage.
Right. Good afternoon, everyone. Myself, Dr. Anshu Raina, Senior Consultant at Apollo Credit Hospital, Greater Noida. So today I'm going to tell you about what is the abnormal uterine bleeding. That usually we just write a term AUB, that is abnormal uterine bleeding. So basically, abnormal uterine bleeding is a abnormal menstruation. So whenever it happens, the more than the normal amount and any bleeding more than normal amount at any age group, menstruating age group, that is a 11 to 50 years of age. So that is called a abnormal uterine bleeding. So why it be called as a abnormal? Because there is a specific amount and the duration which should be maintained throughout a life period of a reproductive age group woman. And if it's happening more than the normal amount, more than the normal duration, then it's called as a abnormal uterine bleeding. So first of all, you should know what is the abnormal means. So I usually we categorize a female in a three groups, and that is one is an adolescent, one is a childbearing age, that is 20 to 30 years, 20 to 40 years, and one is a menopausal, perimenopausal, and the menopausal woman. So these three to four categories, usually we divide a patient in these four categories, and any kind of menstrual irregularity, abnormal amount of bleeding happening during these time, or this is called a abnormal uterine bleeding. It can happen during the adolescent age group, very first starting after a menarche, that is the first periods of in a girl called menarche, and it can happen in that age group, or usually it happens in the bearing age group, that is 20 to 45 years of age. And if it's happening after 45 years of age, then so basically any age group of female, if any kind she is facing a excessive bleeding or more than the normal duration or frequent periods, that is labeled as an abnormal uterine bleeding. So why today I have chosen this topic? Because sometimes the girls or woman is not able to understand at what period of time we should consult our gynec, when we should go to the gynec clinic for a checkup if any kind of bleeding is happening, because they considered is as a normal amount of bleeding, although if it's not happening normally, but they feel as it happens with all female, that's why it's happening with me. And gradually, because of that reason, they used to go in a multiple problems like lack of hemoglobin, lack of blood in a body, that is called anemia, and they land up with the associated multiple problems, and gradually these problems exaggerated and they used to land up in an emergency situation. So first of all, you should aware about what is a normal cycle, normal length of a period, normal amount of bleeding during periods, and what is a normal cycle. So any once girls entered in their menarche, that is, as I said, the first period happens. So after periods, ideally, it's not necessary. First of all, during let me first talk about the adolescent period. So adolescent in menarche, it's not necessary that every period will come on a particular duration and the cycle will be fixed. So usually patient comes when a complaint of the first periods came on that particular time, and after that she's not getting her periods regularly, or sometimes the excessive bleeding for a longer duration. Girls used to bleed and they used to come in OPD for all these problems. So what is, first of all, you should know, or as a mother or as a patient should know, what is the normal amount of bleeding. So any 20 to 60 up to 80 ml of blood loss is considered throughout period is considered as a normal. So how you will assess this 20 or 60 or 80 ml of blood? That is, you can't measure every time, but is if there is a way by which you can say the amount of blood is not normal, it's more than that. So how you will know that? So how many numbers of pad you are using during your periods, and what is the frequency of changing your pads during periods, that itself indicates she is having a excessive bleeding or less bleeding or a normal bleeding. Apart from that, any time you feel there is a clots associated with a bleeding, that itself indicates she is having excessive flow during periods. Because anytime excessive bleeding happen, there is a normal physiology of body which causes a clotting inside, and that bleeding comes as a clot. So whenever there is excessive flow inside, it comes in a form of clots. So if there is any history of passage of clots, and again the size of clots, that itself indicates she is having excessive bleeding or not. Apart from that, if she is having the cycle, if we will take a cycle length, then cycle should be not less than 20 days, and it should be not more than a 40 days. If the cycle comes in between these periods, it considered as a normal. Then third thing is, what is the duration of the bleeding period should be ideal duration. The ideal duration of bleeding should not be exceed more than a week, or if it's happening from 2 to 7 days, then it considered as a normal. The moment it exceeds more than 7 days or 9 days, it considered as a abnormal. So these few basic thing is applied for all age group, starting from adolescent to reproductive age group, or in elderly women. So all menstruating women, these rules are acceptable. Now we are coming to when we will say that things, if it's happening too much of bleeding, how and how often it should be, and when we have to go to the doctor. So if in a, like, suppose every month you are facing similar kind of problem in manner of excessive flow, excessive bleeding, or excessive pain during your periods, or excessive passage of clots, or frequent cycle is happening, that means your cycle is not regular, you have to go to your gynec and consult. So what now we have to know what is the reason behind all these abnormal uterine bleeding. So again, it depends upon in at which age group it's happening. If it's happening in an adolescent age group, the reason is something else. If it's happening in a reproductive age group, then reason is different. And if it's happening in an elderly lady like 45 plus women, then it considered as a it will be the cause is different. So here I would like to tell you, in all age group, causes are different and causes can be different. So first of all, I'm coming to the adolescent age group. If in its heavy bleeding or abnormal uterine bleeding is happening in adolescent blood age group, that means the most of the times when the periods started, the whole body function, that is called a hypothalamic pituitary axis, is not formed or not matured enough to menstruate regularly, or a normal duration cannot be maintained. And most of the time this bleeding used to happen during that period, and there is an irregularity of a period. Sometimes the girl bleed on a normal duration, sometimes the bleeding not happens for 3 to 6 months. So these kind of things is quite expected during adolescent, so we are not bothering for this. When we are bothering for adolescent patient, when the patient bleeds too much, or the duration of bleeding used to extend more than a week or 10 days, then definitely we have to investigate, and we have to give a treatment to a girl to not to go to prevent a anemia during her adolescent age, which causes multiple problems in a girl if she will land up with the anemia. So to prevent that, we have used to investigate, and as per investigation, we used to treat a patient. But most of the time these girls bleed just because of the immature hypothalamic pituitary axis, and they respond very well with a few medicines, and they don't need a further treatment, and gradually after 1 or 2 years of a periods the cycle becomes normal and they don't need any treatment. But definitely whenever these patients come to us, we need to do few set of investigation, hormonal as well as the blood parameters, to know there should not be any coagulation defect, there should not be any lack of hemoglobin, that is anemia, there should not be any hormonal parameters is normal or not. For that we used to give us few set of investigation to know the things hormonal parameters are absolutely all right, and we used to do the baseline ultrasound to know the genital organs, that is uterus, ovaries and tubes, they are well formed and everything is normal. If all the investigation comes as a normal, we just reassure a patient and we just wait and watch for a normal cycle till her 2 years after menarche. Now coming to the reproductive age group. If we will go to the reproductive age group, these there is a lot of list of things which can happen, which can cause the abnormal uterine bleeding. So first of all, we used to investigate and get a patient. Before that, we used to take a relative history, that is important, very very important. Apart from the history, we used to investigate as a blood normal routine blood parameters as well as the hormonal parameters, and definitely we used to do the ultrasound to know the cause of a bleeding. So any time you feel your bleeding is too much, so first thing is to know that what is a cause. Either it's a because of the hormonal disturbance or because of the cause in a uterus, tube and ovary. So cause can be anywhere. So we have to find out the reasons behind that, and we used to treat as per whatever the investigation report comes. We used to treat a patient accordingly. Sometimes, even with all the investigation comes as a normal, then still the patient used to bleed heavily because of some other reasons. And one of the most common is the pregnancy. If you missed your pregnancy, and sometimes the pregnancy happens, and exactly on a date of your expected periods the bleeding started, and patient considered that period as a normal menstruation, and she used to bleed heavily, she used to pass a clot, she used to pass a fleshy mass. So they used to come, but that they used to diagnose as a pregnancy, because pregnancy is the one of the commonest thing which by which patient used to present with the excessive flow. So you should never forget to do a pregnancy test. Even sometimes patients are saying, no, I have not missed my periods, how can I will be pregnant? Yes, you can, of course, because pregnancy happens usually 2 weeks prior to your 2 weeks expected period. So by the time your next period will come, you are already, if the conception happens, so pregnancy can happen, and you will bleed, start bleeding on a day of that. And that is not because of the hormonal disbalance, that is because of the your pregnancy miscarriage, and that bleeding also happens too much, and you will just confused with a excessive flow during periods. So these are the things which to be kept in a mind. Along with that, nowadays hormonal disturbance is a one of the commonest thing by which the patient can land up with the excessive bleeding, and in that especially the thyroid is a one of a major factor, hypothyroidism or hormonal disbalance in the form of prolactin, increased prolactin level. So many hormonal disturbances also causing a excessive or abnormal uterine bleeding in reproductive age group. So all the causes should be ruled out with a list of investigation, and accordingly we used to treat the patients. So now coming to the perimenopausal and the postmenopausal group. The more we enter in a later phase of a life, so more you need an investigation to rule out the other reasons also. As I said, in reproductive age group, pregnancy is one of the commonest thing that can cause a problem. Then similarly, in a later part of life, like once you cross 45, 45, if any kind of abnormal bleeding happens, we have to find out, then there should not be any malignancy, that means cancer should be ruled out as early as possible. For that we used to advise a patient to go for a biopsy, cervical biopsy, in that pap smear, then endometrial biopsy to know what is the reason behind why she is having this problem. And along with that, obviously, the other set of investigation like hormonal, blood routine blood investigation, coagulation profile, and the ultrasound to rule out other regions like a fibroid uterus, adenomyosis, polyp. So these things should be ruled out. So as per age group, we used to investigate a patient, and similarly, we used to treat a patient as per age group. As I said, adolescent age group doesn't need a routine, doesn't need a prolonged treatment, and especially they don't need a hormonal treatment. So we usually treat a patient by giving a tranexamic acid. But if it's happening in a reproductive age group, first of all, we have to find out what is the reason of this bleeding, and then accordingly we used to treat. Similarly, in the later part of life, in elderly women, if she is facing the abnormal uterine bleeding, first of all, we have to find the cause, and accordingly we used to treat. But definitely other factors is very very important to know what are the other factors. Like suppose if the elderly woman is bleeding abnormally, and she has associated diabetes, she has associated hypertension, she needs more attention, and she should be screened for all the malignancy parameters to know that she should not having all this, because they are the one who is more prone for a malignant cells. And we used to be little more vigorous in that patient to investigate. And sometimes if they are not responding with the medical management, we advise the patient to go for a surgical treatment, and that is advisable for elderly age group patient, or the patient who is a postmenopausal and after that she started having bleeding. So they are the one we used to advise to go for a surgery, definitely after doing an endometrial biopsy. So this is all about the abnormal uterine bleeding, and I just wanted to tell you, so for you should, or you should not ignore your excessive bleeding, or you should not ignore your erratic pattern of your periods. Sometimes the patient is not coming, they are six months, every 6 months she is having periods, but still they thought ki it's like a normal, it will happen. Sometimes the few patients are very very pro towards their treatment, so they used to come. So early you will visit for any abnormal uterine bleeding. The treatment modalities are nowadays, it's not a surgical, there is lot of the medical management is available, and with the few so many things like fibroid uterus and all that was used to treated only by surgical method. But nowadays even the medical management is available, and we can treat very well by doing giving a medical management. So early the detection, the treatment is definitely possible, and with the less invasive method. So that's why advisable to not to ignore your abnormal uterine bleeding. You should visit your gynec and get yourself checked, get yourself diagnosed what is the reason behind your abnormal uterine bleeding, and you should get treated for that. And we can just avoid so many complications related with the abnormal uterine bleeding. As I said, anemia, along with anemia the other associated complication used to happen, that can be easily advisable. It will, you will be diagnosed on time, and you will get a treatment for that. So that's all for today. Thank you so much. So I would like to take any kind of question. If you are, you feel any kind of question you want to ask, I'm happy to answer. I'm audible.